Good Friday afternoon, everyone. Wynn Brown here with the Heywood Healthcare Weekly Update for October 16th, 2020. We have a lot of information to share with you today. It's been a very busy day and a very busy week at Heywood. And so this is going to also be a COVID update, which we haven't done on an in-depth COVID update for a while, but the situation is changing in our community. And so I want you all to take time to listen and get the full update so that we are fully transparent with what is going on at Heywood. As also a call to action to everyone to make sure that they're doing everything they can to practice safe practices around preventing the spread of COVID-19 in our community and throughout the region as well. So first, just some of this is a repeat from my update yesterday that I sent to staff, but again, I want to make sure this information is out and that we're very clear about what is going on. So last week we were informed by a long-term care facility that one of our discharged Jerry Psych patients tested positive for COVID-19, so a week ago. And after admission there, they'd been there a week or so and tested positive. I will note that patient was tested negative upon arrival and at discharge from the hospital. So we're not sure if that patient acquired COVID-19 from us or not. But just out of an abundance of caution, we subsequently tested all our staff and patients. One staff member who had not worked in the prior 7 days to the patient's discharge was asymptomatic but tested positive. That staff person has not been scheduled to return to work since per our protocol. Yesterday, we had a GPU patient preparing to discharge to a long-term care facility whose pre-discharge test results were positive. We have transferred this patient to an isolation room in the Watkins unit. Subsequently, we tested the 19 Jerry Psych patients again, and the majority of the unit staff and others who may have been providing care on our Jerry Psych unit. 2 additional patients and 2 staff tested positive. The patients have been transferred to the Watkins unit, and the staff are quarantining at home. All 4 of these positively tested patients, 2 patients and 2 staff, were asymptomatic as well. Our GPU continues to be closed to new patients, and we have limited its interactions with hospital personnel. We're using UV disinfection in addition to our standard protocols for cleaning throughout the unit daily, and we are also delivering staff meals to their units so that they don't have to move a lot about the hospital. All the family members of GPU patients have been informed as to the status of the unit and the health of their loved ones, so we are communicating directly with families. All GPU patients are tested daily for the next 4 days, and staff will be tested every other day. If staff wish to be tested daily as well, that is an option that is fully available to them if that's what they would like to do. These and other infection prevention measures have been taken under the guidance of our infection control team, as well as the Department of Public Health, and they are fully aware of this situation. Staff are reminded to be hyper-vigilant, to include appropriate mask wearing, hand washing, eye gear if you're doing direct patient care, and adhering to social distancing and maximum occupancy guidelines in break rooms. And this is very important for staff. I know we like to gather for lunch, and if you go to the cafeteria, obviously the tables are distanced, there's very limited seating, but also break rooms, you need to be very cognizant of how many people are in your break rooms and make sure that you are socially distanced in there as well, which really takes down the amount of people who can eat at any one time in our break room. So please, staff really need to pay attention to that. Also, starting tomorrow, visitation will once again be restricted to the Heywood Hospital and the Athol Hospital campuses. Patients on comfort measures only will be permitted to have 1 healthy visitor, as well as our laboring mothers can have a visitor with them as well. Patients coming for outpatient services are not permitted to have anyone to accompany them at this time. As always, we know there are special circumstances that warrant accommodation, but the general rule is no visitation for the health and safety of our patients, staff and our community, and our staff and community at large. Limiting the foot traffic throughout our hospitals helps maintain a sterile environment. The safety of our patients and staff are our number 1 priority. We will keep you informed as the situation evolves. I will tell you that earlier today, testing did result that there were no more new positive findings for COVID-19 on our Jerry Psych unit, but we continue to test regularly, as I noted earlier. I also want to let you know that we've seen an increase in positive COVID-19 cases in our area. to include a number of asymptomatic cases. Embedded in this communication is a table reflecting the increase in positive cases in our primary service area, and you'll see there's an increase in a few of our communities, including Athol with 6 new positive cases in the past 14 days, Gardner and Winchendon both with 8 new positive cases in the last 14 days. We currently have 5 COVID positive patients at Heywood Hospital on our walk-ins unit. And as you know, if you've been following our weekly updates, prior to this, we had not had a COVID positive patient in the hospital for the prior 2 months. So we are definitely seeing some level of surge in our region, both in the community being tested and also in the hospital. We also have a number of patients who are also on contact precautions as well, not COVID positive, but have other infectious issues that we are keeping a close track on. Our positive rate right now for the past 7 days is 2.4%. Remember, I think one of the last times I reported to you it was 0.4, so you can see that uptick, and the state rate is 2.8. So we are trending very closely to the state, where we historically have been well below them in the positive rate. So I'm just trying to give you a call to action that we need to be as good as we were earlier in the pandemic, and as a community and as a region set the pace for the rest of the state, really, for how well we did. Moving on to some employee announcements. You should have gotten an email this week that we are making some changes in the annex building across the street from Heywood Hospital. This is to accommodate the addition of 2 new outpatient psychiatrists coming to join Heywood Medical Group. A child, an adolescent psychiatrist, and an adult psychiatrist. So we're expanding our outpatient offerings in that area. So what will be happening is HR, which is right inside the main entrance door now, will swing around to the Matthews side of that street side of the building, and HR will be there, and we will put the psychiatric practice, behavioral health practice, where HR is now, right inside the main front door. So this is a temporary solution, not permanent. We are struggling to have adequate physician office space in our region. And so this is our stopgap measure to make sure that we can have those services up and ready to take care of everyone. In addition, we are also working on flexible space for staff who are working from home or want to work off campus. And so we'll have an update for you coming up in the next month or so on that. Also on the Heywood Hospital campus, the back parking lot, which overlooks the lake behind the loading dock, will be closed on October 21st, and it'll be closed for 2 to 3 weeks as we do our central stairwell renovations, which are accessed on the back side of the hospital. So please plan accordingly if you typically park in that back lot. Some positive news. Sue Peary, who is our manager of cardiology, wants to recognize the ECHO staff during Ultrasound Awareness Week. Our ECHO lab staff do a fantastic job, and we echo Sue's comments provided in this email, which accompanies this video, and thank you for all you do to our ECHO techs. Just a couple of notes from Sue Peary that she shared with me today. It's a very exciting time for ultrasound. We have 2 new Philips ultrasound machines, the Epic CVX and the Affinity, a lighter machine for portable echoes, and we will receive an upgrade to our existing Epic 7. We've added a software application called Automated Strain Analysis to one of our systems. This will help us better evaluate chemotherapy-induced cardiomyopathies and cardiac dysfunction from exposure to cancer therapeutics. We perform echocardiograms, contrast echocardiograms, bubble studies, and transesophageal echocardiograms and stress echocardiograms. At Athol, we do echocardiograms, contrast echoes, bubble studies, stress echocardiograms. So we have a very robust echocardiogram program across the system, and I appreciate the staff and all they're doing. Looking at some feedback to share, some positive feedback, and we're going to focus on Heywood Health Center for Women, which is finishing up its renovations and its new front entrance right off the main lobby next to the gift shop at Heywood Hospital. And so those of you who go to that practice, I think, are going to be very pleased with the upgrades and changes and facelift we've given to that practice. So here's some comments on the providers in that practice. Dr. Andrea Demore. This was my first appointment with Dr. Damore, having seen a different doctor with the group several years ago. I found Dr. Damore to be knowledgeable, straightforward, and compassionate in dealing with my concerns, giving recommendations I was comfortable with, and scheduling a follow-up appointment to monitor my progress. Dr. Jeff Blake. I've always enjoyed Dr. Blake's down-to-earth manner. He tells you what the situation is and what we are looking at. Dr. Jonathan Grogan. I was referred to Dr. Grogan's by a primary care doctor and can't say how great my interaction was with him. He was prompt, no excessive wait once you were in the room. He was thorough in his explanations and listened to my questions and concerns. I was experiencing a significant amount of pain during my procedure, and Dr. Grogan's recognized that. He let me decide whether I was comfortable in continuing or making alternative arrangements for my test later. Dr. Grogan's bedside manner is top-notch. And Dr. Liesl Irisari, she was very easy to talk to and friendly. She answered all my concerns. So some nice feedback on our OBGYN physicians who are enjoying their expanded and renovated space. Some reminders to staff and to the community. The Healthy Harvest 5K is coming up on October 31st through November 1st. There's a registration link in this email. I want to thank our sponsors, Coveris, Hospital Medicine Solutions, and McLean Hospital. We appreciate their support, and a full list of our sponsors are embedded with this email as well. We also have workforce needs at Heywood and Athol Hospital and our medical group. And so please visit heywood.org/careers if you're interested in learning more. A number of these positions can also be done remotely, so please take a look at that. And I just want to thank you for your support, and I appreciate the community working with us and using all the recommended practices for safe hygiene so that we limit and slow down the spread of COVID-19, which is not only beginning to surge in our region, but across Massachusetts and through a lot of the country. And we are coming into the cooler weather where more people are indoors, so make sure you're doing everything you can to help us on our journey to be one of the best community-owned health systems in America. Have a great weekend. Thank you.